Thank you so much for joining us. So we will stick to health this Friday, OTGIF by the way. It's November 8th, 2024, just in case you're watching from wherever you are in the world. We have with us Professor Udo Anye here. Apparently she is a consultant, orthopedic and arthroplasty surgeon at National Orthopaedic Hospital here in Enugu State. We'll just continue the conversation where we left it off from the professor earlier. Good to have you. Good morning, ma'am.
Good morning, Prof.
Good morning, sir. Good morning, ma'am.
Good to have you.
Thank you. Same here.
So, straight up, what is arthroplasty and why is it important?
Okay, arthroplasty is a surgical procedure where you replace a diseased joint with a prosthesis. So in other words, the joint has been destroyed there are different pathologies that can lead to that, and then you can't treat without surgery, and so you do a replacement of that joint with a prosthesis, and the patient can function normally without pain.
Wow, well, that's all about bone health.
Yeah, all about bone and joint health, yes.
Yeah, but what specifically, do you think that people do that affect the bone negatively?
Yeah, bone, joint, the point is that a whole lot is related to bone health. The specific things they can do, one is something they have no control over with age.
Okay.
Age is something you have no control over. You're going to age. So as you age, a lot is going on with your joints. It's not as supple as it used to be when you were younger. And then it starts degenerating, getting worse, stiff, and so many issues. So that can happen. Then sometimes you have trauma, injury to the joint. Yeah, can affect the joint. And then some other things can affect the joint. Some inflammatory conditions like rheumatoid arthritis. Some can have infection in the joint. And with respect to the bone, like I said, particularly for women at the point with age, our bones start thinning. So something called osteoporosis. So the bone is not as strong as it used to be. So it's easy for an elderly woman to just trip and fall and fracture than someone that is much younger to do that. So there's a whole lot of spectrum with respect to the bone and joints.
So are there specific food, for instance, if you're a young person, that you could eat, or a specific diet you could eat that you could be on that would assist your bones to be stronger, at least stronger into old age or something?
Yes. We all talk about calcium and vitamin D. I'm sure here in the internet people talk about that. Food that contains that are high in calcium, and they are good, they're advised. Vitamin D is something that we can all get from outside the sun. The early morning sun can get a lot of vitamin D there, but high content vitamin D, calcium, food substances are very good. People need to be careful with a lot of junk food these days. People are in a hurry, they just pop anything, and a lot of people are not eating healthy. So we also need to look at that. Are we eating the right things? Okay, and then exposing ourselves to the sun. So everybody enters the car, moves, and then comes back the same thing. And again, activity. A lot of people are leading sedentary lifestyles. So go to work and you sit from morning till evening. You're not moving around. You're not loading your bone, because when you load your bone, the bone becomes stronger. When you do not load your bone, it gets to be lighter and more prone to fractures and all that.
Okay. So what are the types of surgeries performed in an orthopedic hospital in Enugu?
So many surgeries. Okay, where do you want me to start? Okay, let me start with my own soft specialty. Yeah. That's arthroplasty. Okay, so that's one we do. Joint replacement. Arthroplasty is like joint replacement surgeries. That's what we're talking about. So you have hip replacement and knee replacement. Presently, we're doing a workshop right now that is ending today. We've been offering that services at a reduced rate to patients since Monday to continue this. We finished today. Okay, so that's one. We have spine surgeries, different pathologies in the spine. You have a scoliosis, like a bent spine. You have maybe fractures of the spine. You have infections. So there are surgeries that can be done to the spine. You have bone limb corrective osteotomies, that's correcting deformities in the limb. Okay, so these are what we do. So you have someone that has a bow leg or a K leg, and they come for some corrective surgeries. We call it corrective osteotomy. surgeries. Then of course, trauma. Trauma is I think is the biggest thing orthopedic hospital does. Lots of people coming with road traffic accidents at home, fall from palm trees and all that, and they have fractures, so we fix fractures. There are some, of course, you must not do surgery for all of them. If surgery is indicated, we'll do that. So fracture fixation is one of the common surgeries in orthopedic hospital. Of course, for sports medicine, arthroscopic surgeries have been done. Then, of course, for pediatrics, we have some deformities children come with, and we can correct those in the hip, any other part of the body. So there's a whole lot of surgeries being done at National Orthopedic Hospital.
When you talked about the joint, the arthroplasty, I'm wondering, you say you replace, you fix. I'm wondering, do you fix it with rubber, or what exactly do you fix
what
it
happens
with?
there? So you remove the disease. Excuse me.
Yeah,
you remove the
that.
diseased part, and they have a prosthesis, a metal prosthesis.
Okay.
Okay.
That's not harmful to the body.
No, it's not harmful to the body. So you replace that, and the person can have a joint that is functioning normally. Because when you have arthritis, a joint that has a space for you to move, what is in between is destroyed. So you have first, at the point, you get bone on bone, and patient is having pain. It's not supposed to be so. So when we recreate that joint with the prosthesis, you have that normal gap, and the patient can function normally.
What about the flesh, the muscles, and do they also form around the metal you put aside?
We are not touching the muscles. We are not. We are only going through the muscles, get to the joint, work on the bone, and then flap back, keep everything back nice and smooth.
Okay, so how does the hospital determine whether a patient is a candidate to orthopedic surgery?
How does, more like the patients, how do they determine whether they need orthopedic service?
Yes.
Yeah, so basically, what I advise, if you have any issues with your bones, your joints, your limbs, upper limbs, lower limbs, your waist, your spine, your neck, all those places that the external you can see, just come to the hospital. It's easy for the doctor to tell you, okay, this is not an orthopedic problem, this is where you should go. But when you're not sure, and it has to do with your bone or your joint or your spine, just come to National Orthopedic Hospital. We handle all those. Okay? If for instance, you come and find out, this is an internal thing, it's a chest problem or abdominal thing, we can now refer you to wherever it is. Yeah, but when you have like someone is going, going to market and she twists her ankle. She feels, I can sort this at home or at a traditional bone setter. No, you should come to National Orthopedic Hospital or to an orthopedic hospital, wherever UNTH that has an orthopedic service sparkling. Get to see an orthopedic doctor, because the earlier you sort out that problem, the better. Otherwise, it drags. And by the time it drags and they feel, this is not working, they start coming to orthopedic hospital. So when you have an injury, the simplest thing you can do is put something cold around there to cool the area, and then get to the hospital. Not going to massage. Most people see people, they start massaging and rubbing all sorts, and they advise, go to traditional bone setters. It shouldn't be. We have a lot of people coming with complications from traditional bone setters come to National Orthopedic Hospital, because they do, sometimes someone has a fracture and they go there. The body is somehow that if you have a fracture and it's together, aligned, and you keep it in one place in 6 weeks, it will heal. But if you go to those places and they tie the thin splints they do and tie too tight, and it knocks off the blood supply, the limb comes dead. And then you see a limb that is black, coming like it's black from here to here, it's black, it's dead already. So we don't want that. So if you have a fracture, just come to the hospital and it will be sorted out immediately.
Yeah, sticking with that topic of traditional bone setters, we've seen severally, especially those who are old, they would rather go for traditional bone setter because it's cheaper compared to the orthopedic hospital. I'm just wondering if it is affordable, doing bones and surgeries in the orthopedic hospital.
Yes, it is affordable. Well, I won't say to all, because ideally the government should be able to make things affordable for the patients, the health insurance scheme. And not even everybody is under this health insurance scheme. They should be able to find a way to help those that are not under the health insurance coverage. Yeah, but I believe if you come to the hospital and you have a fracture, you can actually be fixed that day, and you go that day or the next day. It is possible, it happens. But most people, they go there, and when they have complications, they come back. So at the end, they pay a lot more because they've dumped their money with the traditional bone setter, and then there's a complication, you come back to the hospital. That's double payment. So it's best for you to just come to the hospital. And when you come to the hospital, you can ask them, how much do you think this is going to take? And you'll be surprised that some people can afford it, but they don't know they can afford it. So I don't think there's any, even the arthroplasty that is pretty expensive. I tell somebody, if you have, your mother is there, has a bad knee, bad leg, can't walk, hasn't been walking. And because if you're told the cost is so and so, and you can afford it. Let's say for some reason now, our people here, someone dies, they raise a lot of money for burial. And I'm like, rather than raise that money for that burial, please channel it into treating the woman. And that's all that money can go to making the woman have a comfortable life till she dies, rather than waiting till she's dead and then raising that money. Okay, that's for arthroplasty. But back to the trauma one. Most trauma fixation, and some, if it's aligned, you can just have a cast and the patient goes home. You just POP application without any complication. But if you go to traditional person, something as simple as a fracture here that can be sorted out with a manipulation and a cast, someone comes with a dead limb. And sometimes you do x-ray, there was no fracture, just they had an injury, there was some swelling, they went, they were massaging and tying all sorts of things. And you feel your pain that this child didn't even have a fracture and she has a dead limb, or he has a dead limb. We don't like that.
There's this misconception about coming to orthopedic hospital and then just having a little fracture. But when you come to the orthopedic hospital, you end up having your leg or your arm amputated.
And that's, like you said, it's a misconception. It's a very false one. Yeah, people keep saying that, oh, when you go to orthopedic, you can have your leg. I mean, I go to orthopedic practically every day. My legs are still intact. It's a false statement, for crying out loud. Okay, so if you have a fracture and you come there, it is sorted. What happens is that when you have a fracture that has been complicated outside by the traditional bone setters or whoever that attended to it, and you come with a limb that is, you know that limb is dead. Oh, a dead limb is dead. You need to get it out. That is the indication for the amputation. You can't have a limb that is doing good, just fracture. Even if you have multiple fractures, it can be salvaged.
What's the follow-up process for arthroplasty? What's the duration like? Do you people have that process where you follow up on a patient after they must have gone through arthroplasty?
Yes. So in the hospital, follow up. Okay. So let me start from the hospital. So you had your surgery today. Today, they start the rehabilitation today. By tomorrow, you should be walking around. Ideally, you can actually walk that same day if your pain control is good. You can walk that day and you start walking around, rehabilitation and all that. And once you're good and we see that you're comfortable walking and going down the staircase with your crutches, you can go home. And then we follow you up from the house. So from home, when it's time to remove the stitches, you come from home and get the stitches out. Okay? And then we follow you up 3 months, 6 months, 1 year, 5 years, and like that.
Do they have to report back to the hospital every time?
That's why I say follow them up. That's reporting to us to see how you're doing after 3 months. That's after 6 weeks, after 3 months, 6 months. So you just come, then 1 year, after that, maybe 2 years, and then 5 years. So they don't need to be coming to the hospital like frequently.
Would they be on medications? Why
no, usually by the end of 6 weeks, they are done with all the medications they need to be taking. If they need to take anything, probably supplements, like for women, we tell them, be on calcium and vitamin D supplements from time to time.
Let's talk about surgeries. People are afraid of surgery. So, but I want to know, how does the hospital prepare people physically and mentally, to prepare them for orthopedic surgery? Because no one want to go for surgery. I mean.
Yeah, so we counsel them, we talk to them, we let them know what we want to do or what is required to be done for the person. Let them know people have done this. So the basic thing is counseling. When you talk to the person and the person knows what to expect and how long this is going to take, they're a little bit more comfortable. And if that is the only solution, because if there's another solution, we offer them that. But if the surgery is the only solution for that pathology the person has, and the person understands that, they tend to agree to it. Because remember, you can't have surgery without consenting. You must give us consent. We can't just drag you in. So we talk to them. And when they're not comfortable about them, we sit them down and explain. Sometimes we show pictures about surgeries, what it's like, and then they understand. And most key into it, yes, there's some element of anxiety. Like, oh, will this go wrong? Will this, that kind of thing. They ask those questions. So we always give them opportunity. Ask a question, whatever question you want to ask. Ask, and we'll answer you.
Let's look at the pediatrics right now. How do you manage children, who go through orthopedic surgeries?
Manage them in what sense?
In terms of, taking them through the surgery part, and then, I don't know, it's just seemingly this tenderness, taking them through the surgery and looking at them as, because they're children. How do you manage?
Yes, they are anxious, are probably crying, wondering, all these people in white and all that. So they panic and all that. So most of the time, we tell them to stay with their mother, whoever it is that is close to them.
During the surgery?
Not during the surgery. Before, in the preparation before surgery. So by the time you sedate them and make them calm, the mother can go. Do you understand? Then we can continue what we're doing. We cannot take them in. But most of the time, they stay, when they see someone they're comfortable with, they are calm. So when you set the line, you now give something that can make them drowsy a bit or whatever, depending on what we're doing. Most of the time, general anesthesia. And then they can now carry the child in, and the mother can go.
Are there risks?
So we'll have a way of.
Okay. Are there risks associated with joint replacements, and how are they minimized?
Yeah, there are risks associated with every surgery. Yeah, for joint replacement, the most dreaded one is infection. You can have infection. You can have fracture around the while you're doing that. There are risks associated with every surgery. So the only what we do is that they get to know their risk, and let them know that this is what we do to avert those risks. Okay, so we tell them we do this and we do this so that this doesn't occur, but know that this is a possible complication. So that, like I say, we tell them, ask every question. All your worries, just pour them out to us, and then we allay your anxiety and your fears.
But for infection or for infected bones, how do you mitigate against it?
Are you talking of just infected bones, or with respect to arthroplasty?
With respect to arthroplasty.
Okay, it's a whole lot. What we do before to prepare them for surgery, we look out for signs of infections, any other part of the body, because that can actually sit into the joint. So we see if you have any other infection elsewhere, we try to sort all that out before we plan for the surgery. It's not an emergency. Joint replacement is not an emergency. So we tend to prepare them well. So that preparation to look out and avoid infection starts from what you do outside. We look at all that and prepare. Make sure the patient's blood level is optimal. Make sure the nutrition level is optimal and all of that. So there's a whole lot of investigations we also do to see if there's any sign of infection somewhere along the line. And then we tell the person, let's sort this out. When we sort that out, you can now come and plan for the infection. Then, of course, intra-op, we give antibiotics. Perioperative antibiotics is so important. There are a lot of things we do within the theater space where you're doing it, the ward where the patient is going to go to. So it's a whole lot of information and preparation to prevent just that infection. So the pre-op preparation, the intra-operative preparation, and then post-operatively what you do. So we don't take chances. Because I don't want someone paying so much and at the end, it's a disaster. When you have an infection, it's a disaster. So we don't want that. So we do everything to avert infection.
So what role does physical therapy, play in the recovery process of orthopedic surgery?
Very, very, very important. We don't joke with the physiotherapy, and we start our physiotherapy before even the surgery. While they are still coming to the clinic to get to know what's going on with them, we start them with physiotherapy. So because we need the muscles to be strong and optimal, we also need the joint also to be supple as much as the pain can allow them. So you see somebody comes and says, one thing I don't like doing is I don't like operating on someone from a wheelchair, taking someone from a wheelchair to the theater. So I'm telling you, you have to walk. So my daughter, I can't walk. I haven't walked in ages. I'm like, we are going to do everything to make you walk before we plan for this surgery. So that physiotherapy, we don't joke with it. So we start building up the muscles. When we start building up the muscles, very simple exercises we teach them. In 6 weeks, they are getting up and using a frame to walk. This is what we want, for you to get up and use the frame to walk before we can take you to theater. And after theater, we continue with the physiotherapy, because no matter how expensive the joint you're putting in there is, if the muscles are not strong, you can't walk. So that physiotherapy is very important.
What specific kind of exercise? I've heard you say things like exercise. A professor also mentioned exercise. And types of exercise. Some even say by just sitting down is an exercise. So I'm just wondering.
By just sitting down?
What's this one that you people call it disease? You sit down and do.
You can actually sit down and do a lot of exercise.
Squatting.
You can actually do that, sit down. Like those people that are in wheelchair, they are sitting down. I will tell them, keep your leg up, raise it up in the air against gravity, not put it on the stool. That is not exercise. But sometimes when you tell them raise it up, say, I've been doing that. I said, show me how you're doing it. And they tell them they brought a stool and put it. I said, that's not exercise. What we mean is against gravity. So you just hang it in the air. You can be moving your ankle like this. You see your muscles will be contracting. Just start with that simple one. By the time you do it, you can graduate to others. So simple exercise is sitting down, carry your leg up, or even just like you're marking time in the air. Just anything seated. By the time you do it for 2-3 weeks, it's easier for you to stand and move. So that's the simplest, and a lot more that we do to strengthen their leg muscles so that they can walk before you take them in for surgery.
So how does the hospital, handle cases of multiple surgeries or complex reconstructions of bones? How does the hospital handle those cases?
Yeah, one person can have need for multiple surgeries. Let's say, for instance, in trauma, and someone can have a fracture all over. You plan it on how you're going to do it. The ones you can take at the same time. You have enough hands in theater. You can do, maybe if it's on both limbs, a team can be working on this or a team can be working on this, and so
do we have enough hands in orthopedic hospitals?
Oh yes, we do. We do. We have enough orthopedic surgeons. I remember orthopedic is also orthopedic and plastic surgery. So we have enough hands in orthopedic hospitals. So if there's need, we have enough hands. Then let's not go there. Then we have more than enough hands to handle any case.
So what type of exercise would you recommend for everyone? Because you mentioned that for you to have that healthy bone, you have to be exercising. And you said that sitting down is not an exercise, except there's types of sitting down exercise that you can actually do. But generally, what type of exercises would you recommend?
The simplest is walking. Okay. Yeah, people come, people have arthritis, joint have arthritis, and then they go like running and jogging and all that because they are told, oh, you need to lose weight, you need to do this. And I tell them, you have arthritis. You cannot be loading. Your running means you're going to be loading the joints, and when you land, it hits the joints, it destroys that thing some more. So you cannot be running and jogging. Anything that lifts you up or skipping, lifts you up and drops, it loads the joints some more. So the simplest you can do is walk. Walk, move up and down. Walk, walk, walk. You can't go wrong with brisk walking. Okay? If your walk entails that you sit at the desk for long hours, give yourself, you can put an alarm every 1 hour. You get up and move around. I tell some people, when your phone rings, get up and answer it. That way you're forced to not just sit down, just forced to stand up and then do something. But activity is so important. Movement is life. Just keep moving. Even when you're here, you can actually be moving your leg up and down while you're there. Just movement. Move. So the simplest you can do is walking. There are so many exercises you can do. Dancing is a beautiful form of exercise. So you can just move, dance, put on music and just dance, or put the music in your mind and just be dancing. So exercise. There are so many exercises, but the simplest you can do is walk.
Lastly, before we let you go, what specific advice would you give to the patient out there, anyone out there who would want to come to the hospital, to undergo any surgery? But maybe the person is, looking at this phobia, they want to go through surgery and all of that. What specific advice will you give them?
Well, I think what I would do is, first of all, let them understand. When they understand why they have to have this surgery, it's easier for them, and then explain to them what the surgery is about, what we are planning to do. It's easier for them to accept it. And I tell them I've had 2 surgeries, and the important thing is that it was needful. Do you understand? Once it's needful, it's easier for them to accept it. There's no other alternative to that surgery. And then I let them know, we have good hands, we have good anesthetists that will put you to sleep, or some depending on if it's a limb. For us, most of the time, they are awake. So you're awake and you know what is going on, and that you won't be seeing what is going on. So when they know all that concerning the surgery, they are more comfortable. And it's easier for them to accept it.
Thank you very much. You've heard it, that there are many good hands at National Orthopaedic Hospital in Enugu. So you would want to go and check yourself. Thank you very much, Professor Udo Aye here. Thank you for your insight this morning, and that's the most we can take for the interview. We'll be moving ahead to our Abuja studio for the continuation of the Signature Morning Show.